everyone. I'm with Jennifer Hoponick Redmon, who is the Senior Director at Environmental Health and is the Senior Director of Environmental Health and Water Quality at RTI. And yeah, so just getting into it, could you talk about RTI, what the mission is, and how you all implement the mission and how far the outreach is?
Sure. Thanks so much for having me. So I am with RTI International, which is a nonprofit research institute, and we are dedicated to turning knowledge into practice with science-based solutions that have a positive impact on the health and well-being of people across the globe. RTI originally was founded in 1958 in Research Triangle Park, North Carolina, and the goal was to prevent brain drain from area universities and try to create this science and research hub. And since that time, it became a really international organization with offices in DC, across the US, and around the world. And we have a variety of different areas that researchers work in with about 6,000 people globally. And that includes the environment practice area, which is where I'm sitting, as well as areas across education, health, analytics. We have a laboratory sciences group that we work with and international development as well.
Very cool. Yeah, that's awesome. And could you talk about your work on the CleanPlus concerning clean water and environmental health?
Sure. So we have worked with various federal, state, and local agencies and organizations on environmental health and water quality issues since RTI's inception. A lot of that focus in our group previously had been on risk assessments, identifying the risks associated with exposure to various contaminants. In about 2016, when there became a lot of national awareness about lead in drinking water in Flint, Michigan, there became national discussion of this topic. And in North Carolina specifically, there were legislative discussions about, well, is there potentially lead in water here in North Carolina? And it was really difficult for there to be changes made with a lack of data and an understanding of what the costs would be to do the testing to potentially do mitigation. So what originally happened here was, well, we don't know if there's lead, and also it might be too costly to fix it. So there weren't legislative changes that were made. At the same time, I had my own kids in childcare here and was looking around changing their childcare location in these areas that had older buildings. And so I was concerned there might be lead, and there's no requirement to test for lead at the tap at the time. And then the other part of it is we also, because RTI started in 1958, we also had some older campus buildings and older water infrastructure. And so had taken on a voluntary monitoring campaign on our campus to identify if there were lead issues at any specific taps for employee health. And so we did find that there were some instances of lead at the tap on our campus, and RTI, being a research organization dedicated to their employee well-being, actually proactively put in changes so that we would have lead-free tap water at our campus. This also provided this awareness for employees at RTI and was a win, right, for us organizationally. But at the same time, kids outside of our campus across North Carolina and the US didn't have these same opportunities for testing and mitigation. So because RTI is a nonprofit and we reinvest our revenue back into areas that should be focused on where there are data gaps and where we could do research to help improve the human condition, we were able to get an internal grant to actually pilot the original clean water study that we did to identify, one, if there were water quality concerns in child-occupied facilities where children are going to be while their parents are working or they're outside the home. And two, if we could do that in a way that was scalable and was possible with limited resources, which was a lot of the prior concern that things would be too costly to fix. So that was kind of the inception of the original Clean Water for Carolina Kids pilot study. And for that, because we're focused in the Triangle of North Carolina, we had triangle counties that we focused on, and about 100 child care centers signed up to participate. And we used what at the time was a newer approach that hadn't been done at large scale, which was called a participatory science approach, to do this testing. So previously, and in some areas there had been voluntary testing, professional consultants had come in and gone to each facility to test buildings. That really increased costs because you have a professional going and having to physically be on site in each geographic location. It also really increased costs and logistical issues because to do the testing properly, the Environmental Protection Agency recommended that you did it after not using the water for at least 8 hours. So that meant being on site super early in the morning, and that also meant potentially the facility not being able to use their water until this testing was completed when they need to be operational for their students. So we were able to address those two concerns, plus making sure that we actually include people in the process by training them why this is important, how they actually can collect their own water sample following a proper protocol, and then ship it back to us using a prepaid mailing label. And so that super simplified what was this, enigmatic problem over the course of several years of how would you test everywhere. And that in and of itself was a real outcome of the pilot study to show that that's possible. People that don't have science backgrounds and aren't professional consultants can do this. And actually, it's even better to empower them to understand why you would want to do this and what it means when we find results. So that was the first big thing of the pilot study. The second big thing was that we did find that, in fact, lead was common at the tap, and it's not just in Flint, Michigan. Because lead is in our water infrastructure, it is expected rather than the exception that we would find it, at least at detectable levels in most places. So we were able to find it when our statewide study was done in 97% of buildings, detectable lead in at least one tap, for example. So those two things we used as the data to provide to the state of North Carolina, the Department of Health and Human Services, as scientific justification that, yes, we do see that there is lead, some of the times very high lead at certain taps, and there is a way to do it without breaking the bank. The state of North Carolina, along with the Duke Environmental Law and Policy Clinic and a nonprofit organization dedicated to children, NC Child, then utilized that information to help push forward together a statewide rule to require lead testing in all child-occupied facilities for children 6 and under in North Carolina, and that passed in 2019. And so around that same time, the Water Infrastructure Improvements for the Nation Act was passed nationally, and funding started being allocated to states to actually help fund lead testing. So that's what relayed back to from our pilot study to our statewide program, which we actually started in 2020, and coincidentally, that dropped just after COVID started. So we were able to actually proceed with testing every licensed childcare center in the state of North Carolina, over 4,400 during COVID, because we completely changed the approach where we did not need to be on site anywhere. Everything was virtual with an online portal, online training. We mailed out sample kits, prepaid mailing labels went back to us. So the whole process was still possible, and we did not need to delay it. And we were able to find all of the taps that had lead. We were able to recommend changes that child care centers made. And so it was an overwhelming success. And that then allowed us to transition and expand to what we're focusing on is public schools in the state of North Carolina as well, family child care homes. We're retesting all of the licensed centers. We now have funds, mitigation funds as well, where we're actually doing water mitigation. And then on top of that, we expanded to looking at other building hazards, including lead-based paint and asbestos. So that expanded program is called Clean Classrooms for Carolina Kids. And then within our CleanPlus portfolio, we have a variety of other projects and programs, including Clean Water for Georgia Kids, where we're operating a similar program in Georgia. It is a voluntary program in Georgia, and so some of the outreach that we do is a little bit different than in required testing state. And then we have work that we do that's more focused on research studies. So we have an area there where we're looking at the relationship between environmental exposures and children's health over time and educational potential, for example. And then we work with other groups, including utilities too.
Wow. Yeah, very cool. It sounds like some of the first, I guess, like workings of citizen science too, which is really cool to get the like community and citizens involved in this because it is so important.
Mhm.
Um, and so what are the ways to get rid of the lead in the water? Is it filters or is it just like improved infrastructure or what is
Yeah,
that?
that's a good question. So our water infrastructure has been installed across the US over time, right? And there's been a lot of discussion in the news about overhauling it. And there's funding that's being allocated, and there's a lot of work across cities and towns to change out the piping and plumbing that forms the basis of how we get our water for public water supplies. And that is important. And so I'll first go over kind of the timeline for allowable lead in water infrastructure to give you some context. So
Mm.
before 1988, water infrastructure could have had up to 100% lead parts, and there was no restriction on it. Beginning in 1988, the first restriction went into effect, which specified that anything that was 8% or less lead was considered lead-free, and piping and plumbing, and 0.25% or 0.2% in solder. So pre-1988, buildings or infrastructure going to buildings, so in older areas, could contain lead up to 100%. So a lot of times you might hear the words lead service line, for example, and that is a lead pipe essentially that's at least in some part going between where the water's coming from and where the water's going to come out of your tap. Between 1988 and 2014 is this next category that we look at, and that's where that first restriction was in place, but there still was 8% allowable in that piping and plumbing. So You still could see lead potentially in your water, especially depending on the water chemistry and your water usage patterns. So how often you're using that water, the more it stagnates, the higher likelihood that it gets into the water. And then when you turn on your tap, it goes into your glass. Um, in 2014, the next restriction went into effect. And so that is that 0.25% lead is considered lead-free in piping and plumbing. So a reduction from 8% to 0.25%, and then 0.2% in solder. So post 2014 buildings or post 2014 piping and plumbing that you see coming in from water utilities, through town to get to your building, have that lower level. Okay.
Mm.
And then some places might be like a new house in an old town, right? So you might have some older infrastructure, some newer infrastructure. And that's where it can sometimes be challenging to know for sure what's at your tap. And that's why we actually have this whole program where we test at your tap,
Mm.
because lead is a contaminant where we don't typically find lead at the water source.
Mm.
And that is why when water utilities do testing, most of the time water utilities don't see lead when the water source is coming in from either their surface water or their groundwater source or a combined source. And also for well water users, oftentimes, unless you live near an area that has had prior lead smelting or things like that, that actually create that water contamination, we're not seeing it there. So what's happening is it's leaving the water utility or it's leaving the aquifer where your well water is coming up, and then it's going through that distribution piping and plumbing, and that's where it starts getting lead potentially in it.
Mm.
Um, and the question that we have to answer is, one, is there lead at this tap if it's used for drinking or cooking? And two, then where is it coming from? And so, yes, the longer term answer is over time, as we change our water infrastructure, we will be removing available lead from potentially getting into our water. But that is really costly. So on the shorter term, when we have kids right now alive today growing older every day, and we know that there's no safe level of lead exposure, what can we do to stop exposure, even if we're not completely changing infrastructure? And
Mm.
so our program goal has been to identify and eliminate exposure to lead and other hazards so that we improve children's health. And we want it to be where people live, learn, work, and play. So ideally, all of the places. But a lot of the funding has been on child occupied facilities. So that's childcare centers and schools, with good reason, though we also provide these recommendations for households so that kids have that when they get home. So what we typically do then is we do the testing because we have identified that you can't cherry pick or you can't look at a tap and say, I don't think there's lead in this. And there's a number of reasons for that. One, you can't taste, see, or smell lead. So you can't use your senses to know whether there's lead. And having an odor or something like that does not mean that there's lead in your water. There can be other water quality concerns that people have about their water, if it looks brown, if it smells bad, things like that. But that doesn't identify lead. So it's important to test for that reason. It's also important because we have noticed extreme variability from tap to tap. Even within the same building, there can be very different lead levels. And the highest lead level we've seen to date was about 4,000 parts per billion, which, for context, the American Academy of Pediatrics references 1 part per billion as a maximum. There's no safe level of lead, but that gives you some context. So we found 4,000 parts per billion about in a kitchen sink, and that same childcare center had undetectable lead in every other tap. So we wouldn't have known to mitigate that, right? So we look for it, but then beyond that, we provide tap specific recommendations. And so one easy thing that can always be done that costs no money is to simply not use a tap that has detectable or elevated lead for drinking or cooking. And that's the main risk for lead exposure, is really ingesting it. That's the main way that we know that you are affected by it. Dermal exposure, or using it for like hand washing or, washing dishes or things like that, are less of a concern for lead. So that's a zero cost alternative. What we also recommend is practicing clean water habits. So always using cold water, for example, for drinking or cooking, because using the hot water tap leaches more lead. So easy things to do, even if you've never tested your tap, are to make sure you're using cold water. So whether you're making tea or you're making formula for your infant, use the cold water tap and then heat it up on a stove or a microwave or something else. So that's something easy to do. We also recommend flushing your water after periods of inactivity. So that could be just in the morning for 30 seconds or a minute if you haven't used it. If you are away for longer periods, like a holiday, doing so for longer. And for buildings, especially larger buildings, we have flushing guidance on how to flush those taps. That's been something that after COVID, when facilities were closed for a long period of time, some facilities had a lot of issues with lead that they hadn't previously had because the buildings were closed for so long. So there's some no-cost clean water habits that we recommend. What we're doing with some of our programs, though, is we are replacing faucet fixtures when we find lead, because the newer fixtures have less lead that's allowable. And then we're also adding certified water filters. And those two things, without pulling out all of the plumbing and piping of a building, can a lot of times actually stop that exposure for pretty low cost. And we're able to do so in the places we know that we find lead and that they're actually being used for consumption. Another thing that we're doing in larger buildings like schools is we are working with schools to help them figure out how to whittle down the number of taps they actually need to use for drinking and cooking. A lot of older school buildings can have hundreds of taps, right? And so that would be really challenging to maintain if you have lead potentially at hundreds of taps, and then we are, adding filters that then need to be replaced. So we recommend that you whittle down where do you actually want to compel tap usage. And so a lot of times our recommendation is, and we will install water fountains with built-in bottle fillers and a certified water filter. And students can fill up their water from that tap rather than a classroom. And that's been something that has been recommended as well in other states, and there's other organizations working on as well. And that's called the filter first approach, is being recommended. Like in the state of Michigan, there's a requirement now. So the goal is that you have a filter put in with a fountain, and then students only get their water from that water fountain. So that's an important way to try to reduce, maintenance and also reduce time and cost. Another thing that we feel is important and has worked well is actually just providing that education. If people don't understand why you wouldn't want to grab water from a sink, they're going to go ahead and do that. So we have signage that says hand wash only, versus places that you should fill your water bottle up or use for cooking. And we do education with the facilities community to help them understand why. So before we had this program, I mean, my own kids, I saw going and, sneaking to fill up their water bottle in a bathroom, right? And technically they shouldn't do it, but if they don't understand why, they're going to do it, the teachers may not notice or feel like it's a concern. And the real concern is like, if that's the one that has the 4,000 parts per billion, right? You don't want the kids filling up there. So there's both no cost and low cost solutions that we've focused on. And in the limited cases where we're still finding that after that mitigation, the taps are high, then at that point we specify that it shouldn't be used for consumption at all. And, the consideration of pulling piping or plumbing at that point is considered.
Yeah, yeah, wow. Yeah, so you talked about the clean water and classrooms for Carolina kids. So I guess what's the significance of focusing on kids and classrooms?
So we know from a lot of research that children are most affected by exposure to lead. Everybody is affected, including adults, and there's been some more recent research on the cardiovascular effects of lead exposure on adults, for example. But there's an abundance of research showing decreased IQ for children and also behavioral difficulties, including ADHD. And interestingly, there's a wealth of data to show that there's no threshold. So there's not a certain amount of lead that's okay before these effects start. They start with any level of exposure, and they are irreversible, and they are lifelong. And the other part of it for children that makes it really important to focus on ages from being born at 0 years old through 6 years old is that it's cumulative exposure. So if you're exposed when you're an infant, but then you're exposed when you're 1, 2, 3, 4, and it continues, your level of effects goes up, up, up. So you continue to have a decrease in IQ, you continue to increase the likelihood of having those behavioral issues, and all of those compound to decreased educational potential, decreased lifetime earnings, an increase in the risk of juvenile delinquency, and things go on and on. So there's been a lot of economics behind this at a population scale. And it's very interesting because if you look at the amount of money and time and effort that has gone into educational standards and work for kids to meet benchmarks, one of the things that's not typically considered is the water fountain at the school and at the child care center. And that water fountain, if it has lead in it, or the sink in your infant room, if it has lead in it, that could really be the difference between a child being able to meet their reading benchmark or not. And so this is something that we can do to set children up so that they actually have the best chance that they can to meet and exceed those benchmarks, both while they're in childcare, preschool, going through elementary school, and then on through middle, high school, and beyond into adulthood. And so that's why we focus on kids. Kids also, they can't speak for themselves. They can't advocate for themselves. So we're able to do that. We also feel that, we should consider going up through middle school, high school, colleges, anybody that's able to understand and have the education of what you can do. There are things that you can individually do, even if you can't individually change all of your water infrastructure, right? But we want people to be able to feel empowered that they can actually understand and stop exposure to something, even if they can't change billions of dollars of water infrastructure that we have in the US.
Yeah, definitely. And yeah, you answered my next question of how lead is affecting us. Um, so then I guess what methods do you give utility companies to help prevent these exposures? Have any of them implemented the methods? And if so, how's it going?
Mhm. So water utilities have had rules since 1990s. There's what's called the lead and copper rule. And so they have been required to look at lead and copper in a subset of households within their public water supply. Um, there are new rules that will be focused on kids and childcare in school. But what the difference between the lead and copper rule and the difference between what we do is that that is focused on the overall water system to see if it's optimized for corrosion control, to minimize the amount of lead that's getting into water from their piping infrastructure. And it's not focused on public health when you get to the individual tap level. And so what we're focused on is really trying to stop exposure to lead at the tap for every person that is grabbing a cup or putting a pot under that tap. And so we're focused on more conservative and at the tap level, and they are looking more macro, and there's significantly less testing that is required to be done than what we're doing. So we're doing, we did about 30,000 tests, for example, in our statewide childcare testing originally. And each utility is required to test, it's like between 30 and 60 taps on average, most of the time every 3 years for a household that agrees to participate. So what's happening with utilities is there is more of a focus now on going not just with households. There will be a focus on schools and childcare centers, but as it stands right now, they will only be required to test 2 taps per center and 5 taps per school. And so we find that on average, in most childcare centers, there's at least 6 taps that are used for drinking and cooking. And in schools, there's significantly more taps, over 40, sometimes hundreds of taps in a school are fair game for any kid that's in their room and, pulls it out of the sink. And because we have significant variability from tap to tap within the same building, that's a concern for us because it can provide a false sense of security that a building is safe when it really just shows that those 2 taps or those 5 taps are okay, not that all of them are okay. So our recommendation is to really work with facilities to figure out what they're actually using and test the taps that you're actually using. There are some risk factors that we've identified at the building level, and some of those include, again, building age. Because the first restrictions went into effect in 1988, pre-1988 buildings are more likely to have some taps with elevated lead. And then as the buildings get newer, that goes down. Although we have seen some instances of new taps, new faucet fixtures with high lead because there's like some additional leaching at the beginning of replacing faucet fixtures, or because there's an anomaly of the fixture coming in from an import or something like that. So that's a concern. And then, moving forward, what do we do to explain to, students, staff, the communities, what's happening? So that's been a big function of our program, is the educational piece. And so we definitely recommend that there's the working with the community rather than doing it and not explaining what's happening on the back end. Our RTI CleanPlus portfolio, we're really focused on not just lead, but overall contaminants, because there are a lot of contaminants that we have in our everyday environment that we are exposed to. So we are also working on PFAS, for example. We're doing work on identifying and eliminating exposure to PFAS for people, both in water and in their general environment. Microplastics are another thing that we're finding more and more of. There's been some recent research showing that we have the equivalent of a plastic spoon's worth of plastic in our brains from the breakdown of all of the plastics that we have in our environment. So there's some easy things that people can do to reduce exposures. And some of those include, in your household, cleaning, actually just vacuuming up so you are breathing in less dust. There's things like that that can be done so you don't hear these things and feel like, oh, there's nothing that can be done. Um, and, finding out more information about what's in the things that you're near, what's in the things that you're purchasing really do have an effect. And being interested in purchasing things that have less synthetic chemical compounds that we don't need in our bodies is something that's important. An area of more recent research, 2000s and beyond, has been the idea of, it's called cumulative exposures. And so a lot of the risk assessments that have been done for inorganic, organic chemical compounds in the past have focused on one compound at a time, but that's not how humans exist in the environment, right? We exist in our households, in our spaces, and there's really more of a chemical soup that we're exposed to. So more research is being focused on how do we address that and how do we get at how that relates to health effects. And there's a lot of epidemiological work on PFAS, for example, which, a lot of individuals might have heard about, your Teflon pots or pans, things like that, since the year 2000. But there are over 16,000 PFAS that have been identified and that are in use potentially in various consumer products. And so it's really understanding the overall environment that we're in. And so that's what our program focuses on, identifying those things. And if you know with what you're working with, then you can potentially make changes. So for PFAS and PFAS in water, similar thing, we put, lead certified filters. And when we see lead at the tap, for PFAS, some of those same filters work, especially at lower levels of PFAS. At higher levels, there's other filters that are more effective to remove PFAS. So you remove it from your water source. And then another source of PFAS in the environment is your household usage. So we have some studies where, we're talking with individuals about consumer product usage, and we will look at additional environmental matrices. So not just water, but you can look at chemicals in dust, you can look at them in soil, and then how that relates to exposure within your body.
Yeah. Wow. Yeah. There's so much out there, and yeah,
Mhm.
great work. And so how can people support y'all's work?
Well, if you are interested in what we do, to work with us or just to learn more, you could go to our website, which is rticleanplus.org. We do have a variety of programs that are focused on funding with schools and childcare centers, or research studies, or working with utilities, for example. But we're always interested in working with additional people and organizations. We are a nonprofit, as I mentioned, so we work on a variety of contracts and grants, but also do a lot of educational things as well. And so we actually have some educational curriculum with our Clean Classrooms program that's organized by elementary, middle, and high school. So if teachers, parents, or students are interested in that, there's some focus on lead there. And yeah, if you have any ideas for us, please let us know. But our goal is to continue using this participatory science approach to really get out as much as we can, figuring out where are common chemical contaminants and how do we address them to improve health. And we have an integrated laboratory, so we're able to actually do all of this testing in-house. And we have a lot of multidisciplinary researchers. So we're able to figure out if we have something else weird going on. We have a variety of experts, including those that are focused on risk communication. So how do we actually relay risks of all of these complicated topics in a way that makes sure that we're not just finding more problems, but we're helping with solutions. So we're actually allaying concerns and making people not just feel better, but be better. And then in working with agencies, we're able to help framework what is the universe of what we're looking at and what are data-driven options that could be taken to make changes that are relevant and are useful.
So, what are some other environmental concerns or trends that you see in your work?
Good question. I think that more and more people are interested in understanding the environment that they're living in and how it affects health. And there's been a lot of conversation. So originally about 10 years ago, lead, PFAS, and AKA forever chemicals have become more of an issue where people are wondering, what are they? What are they in? What can I do about these things? And people are showing that in their purchases, to try to buy things that they perceive to be healthier for them. And so that has helped in a way to showcase supply and demand for health. People want to have that in their lives, but it's challenging when most of the work that we do, it's focused on what are essentially invisible chemicals, right? And so how do you know what you're being exposed to? And you can either try to figure that out by, in certain cases, if you're actually purchasing something, are there keywords? Are there words there that show the chemicals? Or are there words that say things like, this is water repellent? And having that understanding of what that might mean. The way that we work on things is we identify definitively when there are chemicals places by actually sampling and collecting and analyzing these things to say we know that this contaminant's in this, so that we can provide definitive solutions. But I think that understanding that people want to have conveniences, but they don't want those necessarily at the cost of their health is something that's important moving forward. And using your voice to show that, and also using your purchase power to show that, has been important. So that's something that I think is trending. The next kind of PFAS in terms of chemicals seems to be microplastics. More people are now starting to say it's not just that we're throwing away plastic, right? And there was, talk about plastic in the oceans. We're putting all these plastic in landfills. But now there's starting to be this concern, oh, there's plastic in my body. And what does that mean? And so plastic seems to be the next PFAS in terms of emerging chemical concerns. And I think it's important for us to acknowledge that as we continue to make things and be on this earth, there will be additional chemicals that we are having to tackle if we use chemicals and then later figure out they're bad for us. Okay, we're finding them in our environment. There's only so many things you can do when you use something, and it goes, down the drain, it goes into the air, it goes somewhere else, and then the life cycle of that comes back around to us. So over time, I think that the cumulative impacts that we see with chemicals and the life cycle of chemicals and those things will hopefully come together for us to have a more integrated approach to managing our environment and how that relates back to our health without being in silos. And that's really the goal.
Yeah, yeah, definitely. That's super important. And then how can people contact or connect if they have questions?
Yeah, if anybody has questions or comments, you can feel free to reach out to us on our program website, which is www.rticleanplus.org. And we also have some of our links for our existing programs if you're interested there. And whether you're just generally interested or you're interested in partnering with us, we'd love to hear from you. We have a support team that is available by text, phone, or email as well for our existing programs too, so you can reach out that way.
Awesome.